News and information 570 AM, 96.3 FM, HD2, KLIF.
Despite an ongoing battle in Congress, it appears that the Affordable Care Act, Obamacare, will go into effect tomorrow, with exchanges opening up. Joining us now is Dallas healthcare attorney David M. Walsh with Chamblee, Ryan, Kershaw, and Anderson. David, thanks for joining us. I guess for a second, let's put politics aside. What can people expect tomorrow?
Sure. Well, first of all, it's buying insurance in starting for January 1 of next year. So all you're doing starting tomorrow when you get on the exchange is starting to look for a plan that you will kick in January 1. And when you go to the exchange, you'll get pricing information on a variety of different plans priced by different insurance companies. And we know that there are 4 main plans by the government: bronze, silver, gold, and platinum, and they have varying levels of benefits with them, the bronze plan being 60% of your health care cost, the platinum being 90% of your health care cost, and then in between with the other plans.
Talking to David Walsh. Okay, now let's play a little bit of politics. Let's start with the Democrats. Why is this such a wonderful, great thing?
Well, it gets more people insured is the real issue, and the whole thought behind insurance is if you have more people to share the risk with you through premiums, it makes the whole thing affordable. So if you have 10,000 people instead of 100 people buying insurance, only 100 people are going to need the benefits in theory, so that it spreads the wealth or the cost, not the wealth, but the cost of the program across a greater number of people, so it's cheaper for everybody that needs it, in theory.
In theory. Okay, we're talking to Dallas healthcare attorney David Walsh. Okay, now let's go to the other side. Why is this gloom and doom, and why is the sky falling?
Well, from one perspective, we've already seen that pricing is, in theory, going up for people. There was a article in the Wall Street Journal the other day that actually had premium costs, and for your average Joe in Houston who's buying the lowest tiered insurance, he would pay about $150 in insurance per month under the new plan, the bronze plan, and under the old system where he would just buy the cheapest insurance available, he was paying about $85 a month. So he's seeing an increase in his health cost. To go back to the Democrat side, though, certain people are going to get tax benefits, tax credits, or qualify for cheaper insurance. And so the government's belief about that is that the average cost of the policy will go down. And let's not forget the cost of insurance in Texas, according to an article I saw on the Fort Worth Star-Telegram recently, was that the average cost in Texas is about $100 lower for the cheapest plan than the average cost in the United States. Insurance is cheaper in Texas, but we expect the rates are going to go up.
Now, let's also go back to the Republican side. They're saying that, we'll just have more part-time people. I won't hire as many full-timers because that way I don't have to cover it.
That's definitely true. And then you see the other side of it too, is that the government mandate for large employers, 50 or more employees, to have insurance, that's being pushed back to next year. So you could have some employers decide, I'm not going to provide insurance anymore in this little interim window that I don't have to, forcing all those people onto exchanges or to be without insurance. And one other Republican idea is it makes the assumption that people are actually going to buy insurance. The penalty is the greater of 1% of your taxable income, or $95. If you're making $15,000, that's $15 by my quick math. Would you pay $95 to not pay $150 a month?
Oof.
Many people will make that decision. Yeah. And then further on the flip side, there was a recent study by I think it was AFLAC that said when people are choosing their employee benefits, they don't necessarily look at the right thing that they need for themselves. They look at the bottom line of how much does this cost me, as opposed to rationally thinking of how much health care or how much employee benefit am I going to need over the next year. And the employee making the decision typically makes the wrong choice. So there's all sorts of complicating issues here that make it more difficult for people to get the right thing. Let's not forget that even the bronze plan, you're only getting 60% of your insurance or your health care benefits paid for by insurance. The employee is still, or the person buying insurance is still having to pay the other 40%.
Okay, we're talking to attorney David Walsh. Oh, I can see benefits from both sides, or I can see arguments, I guess is the way to put this, from both sides. Why are we not seeing more of a concerted effort to kind of work together to come up with something that works?
Well, part of that seems to be government these days, I think, is part of it. And then the other part of it is, on the one side, the Republicans don't want anything forced down society's throat, so to speak, or another great government plan like welfare or Social Security on their side. And truly, if you believe the liberal side of the equation here, you have to have a massive overhaul so that there's not much room for compromise. As I was explaining a second ago, just by pushing back by a year the government mandate that employers with 50 or more employees provide insurance, we can see how some more or less scrupulous employers might just say, well, we're not providing insurance and we're going to save the money over the short term because they're not forced to do that. Well, it's the comprehensive change that's required in the liberals' eyes, so they don't think that there's any room that they can compromise or there's going to be all sorts of loopholes that created the problem in the first place.
Talking to David Walsh, okay, how does this all play out? I mean, obviously we're going to get this one way or the other, but say look down 2 years from now, 5 years from now, what's going to happen?
I think premiums will go up in the short term, but then doctor reimbursements will go down in the long term. So maybe not in 2 years, but in 15 to 20 years, we might have a doctor shortage because the end result has to be them being paid less. Otherwise, it's not going to work out. The whole idea is to have cheaper health insurance, and to have cheaper health insurance, you have to have cheaper reimbursements in the long run, I think. So I think we're going to get this. We might as well adapt to it and figure out the best way to deal with it you can. Some people are going to decide to go with pay the tax and not get insurance in the short term. Other people are going to decide to go with this and get insurance. And then the other thing is employers are going to be forced to provide employees with insurance, and so you're going to see a lot of shakeup in the industry. That's on the one hand. On the other hand, I think the old mandate of the employer picking the insurance for you, I think that's going to change too, and it's going to be more of an exchange-driven thing. You probably read about Walgreens switching to that plan recently, where they gave their employees a certain amount of money to buy insurance. I think almost all employers are going to shift to that. It's the same thing that happened in the 70s and 80s and 90s when employers went from having pension plans to 401k plans. It's the same basic concept where the employer, instead of saying, I'm giving you this particular benefit, they're going to say, I'm giving you dollars, you go figure out what benefit you want to buy. And part because employers are just dealing with what everybody else is dealing with. How do I get a grapple on these escalating healthcare costs that is seemingly going out of control?
David, I appreciate you jumping on for a couple of minutes. If people have additional questions for you or want to find out more about you, you got a website or a phone number?
Website, Chamblee, CHAMBLEE, Ryan, RYAN.com.
David, I appreciate you jumping on. Thanks so much.
Hey, thank you.
Dallas healthcare attorney David